Okay.
It's all yours.
Great. Thank you, Scott. And yeah, the book is, with all the clients, has been slowed down, I can put it that way. All right. So I want to revisit something tonight that we've talked, I think, once before about, but I really, we are immersed in clients here in Los Angeles right now. And I've been really reminded of the usefulness of some skills and tools that we find assembled under the name DBT. And I want to just go over some of those DBT skills a little bit. So DBT stands for dialectical behavioral therapy, which is a big mouthful. It's an offshoot of CBT, which is cognitive behavioral therapy, which is the traditional form of therapy that most therapists use as kind of the core, and they build on top of that. But DBT came around in the late 1980s. This woman named Marsha Linehan, who worked with borderline personality disorder, and they found these skills were very useful to help people with borderline personality disorder function better in different ways. And it's turned out to be very useful, not only for borderlines, but for binge eating disorders, bipolar, bulimia, anxiety, depression, and addiction. And I just find it so useful to remind my clients about it, because this is a set of 4 skills. It's like a toolkit that has 4 different components that's really, really useful for anybody in recovery, but especially early recovery. So I wanted to just briefly go over those 4 different toolkits tonight and talk about what they are, and just have people seek out more help from DBT if you think it might be useful. So the first one of these behavioral change strategies is core mindfulness. And we've talked about mindfulness a lot, but mindfulness is probably the most important strategy of DBT, probably one of the most important strategies we can have anyway, frankly. But it teaches how to focus on the present and to live in the moment. And of course, 12-step program and recovery is steeped in all that. The Serenity Prayer tells us how to kind of identify what we can't control, what we can control. And staying in the present is one of those skills where we can just get lost in the past, we can get lost in the future. But if we can stay in the present and focus on living in the moment, it's a huge leg up in terms of our recovery. So there's a couple things, though, that we talk about with that. One is to notice what's going on around you, but don't judge it. So that non-judgmental attention to what we're thinking, what we're feeling, our sensations, our impulses, just to notice it, make a mental note of it, but not say, well, that's stupid, or God, why am I doing that again? Or all that stuff that gets us diverted and off into the ditch again, really. So don't judge it, just notice. And I think this is one of those skills that grows stronger with time. The more we practice it, the stronger it gets. So really that non-judgmental focus on what's going on is really important. Focus on what's outside of you and what's inside of you. So outside, what you see, what you hear, what you smell, what you touch, those are all the senses. And we talk about even using that 5 sense relaxation grounding technique, because when we tune in to what's going on, it really helps reduce the chatter inside our heads. But also notice what's going on inside. Notice body sensations. What thoughts are you having? Are you struggling holding a thought or focusing? So just kind of being aware of all that. And this just helps us slow down, and it really helps us refocus on really healthy coping skills when we're in the midst of some kind of emotional pain. So mindfulness really helps us stay calm. It helps us avoid engaging in those automatic negative thought patterns. And what we see with a lot of addictive behaviors is all these thing patterns are automatic. We're not consciously choosing this stuff. We catastrophize, we minimize, we rationalize, we do all these things because it's an automatic thought. But if we can sort of engage our brain and make them conscious, we have much more control over where our minds go, where our thoughts go, where our feelings go, and we can start to really manage that. So it's really important. And most of all, we can start to control impulsive behavior, because if we're mindful of what's going on around us, we're aware of triggers, we're aware of cues, and we're aware of responses that we're going to have. So it's a really huge thing. The second one that's so important is distress tolerance. And this is particularly useful for sex and porn addicts, because we know boredom, we've talked about this before too, boredom is a huge relapse factor. And boredom is because it's when we're quiet, when we're low energy, feelings start to bubble up, right? We start to become aware of discomfort or anxiety or worry or fear or or sadness or being lonely, all those feelings that we have a very hard time dealing with start to bubble up, and we start to really get aware of them. So what do addicts do? What's our strategy? We avoid them, but that's not a healthy thing to do in recovery, obviously. So distress tolerance, the second core feature of DBT, distress tolerance helps us learn how to literally build up our strength to deal with that distress, learn how to tolerate sitting with discomfort for a while. And something that we have a hard time doing. Nobody wants to sit in discomfort, but sometimes we need to be able to do it. And that discomfort may be boredom. It may be, as I say, loneliness, fear, hurt, anger, whatever. But there's really four main techniques that are used in terms of this distress tolerance. First one is distraction. So we know that our brains can't really focus on two things at once. The multitasking is really a myth. When we say we're multitasking, we're just doing what's called rapid switching between different things, but our brain really can only focus on one thing at a time. So distracting ourselves is a really important way to interrupt the distress we might be feeling. Self-soothing, but in healthy ways. So making a program call, taking a walk, doing some deep breathing, doing something healthy in terms of self-soothing. We know a lot of other ways that aren't so healthy to self-soothe. We obviously don't want to do those. We can improve the moment, do something, take some action to change. If we're bored, let's make a call. Let's clean a bookshelf. Let's do something to engage ourselves, right? Instead of just sitting there feeling miserable. And then finally, looking at, and this is something DBT does well, this kind of decision making. Look at the pros and the cons of tolerating the distress or not. Sort of consider the situation you're in and what your options are. So that's an incredibly important one. The third one is what DBT practitioners called interpersonal effectiveness. So this is becoming more effective in how we handle other people and ourselves. So the main area of this, I would say, is assertive communication. Assertiveness is really the way we ideally should communicate, as opposed to being aggressive, right, or hostile, or passive aggressive, kind of indirectly hostile. So being assertive, for example, learning how to express your needs. I need this, or I need that, or learning how to say no, which is something I still have problems with. So learning how to do all that is really effective. And this also helps us keep relationships positive and healthy, because we're getting our needs met. We're saying what's on our mind. We're asking for what we need and what we can do. Another really important part of this, in addition to expressing our own needs, is to learn how to listen, and really learn how to listen effectively, so that we can really let people know that we're actively listening to them, that we know how to really not interrupt and show up and be present and not hijack the conversation, all those kind of important aspects of listening. So that's one aspect of interpersonal effectiveness. I wanted to, in this little brief talk, I wanted to give a couple examples of some of these techniques. So that interpersonal effectiveness, one might be this exercise, GIVE, whether it's an acronym, GIVE, to improve relationships. So, and this is how DBT works. These little things you can kind of remember. So GIVE, G for gentle, don't attack, don't threaten, don't judge, okay? I, the second letter of GIVE, is interest, show interest in terms of good listening skills. Don't interrupt, don't make it all about you, just kind of listen and be a good interested person. The third one is validate. Acknowledge the person's thoughts and feelings. They may be different than your own, but we can acknowledge how they're feeling, and that we hear them and we understand what they're saying. And then the third one, E, easy. Try to have an easy attitude, smile, lighthearted, just as a mindset for the day. So that's a great example, I think, of DBT, which is it's a little acronym. You can remind it just keeps us on track with these skills. And then really quickly, the fourth one of these is emotional regulation, which is really a set of skills that helps us navigate strong feelings. And strong feelings is something addicts don't do well, at least in early recovery. So this looks at how we manage our emotions. So it's important to identify them, to name them, and then we can think about if we need to change them or not. So by identifying them and naming them, and then I would say releasing them, by sharing them, by talking, by giving giving them away so that they're not dragging us down. That's a really, really critical piece. By doing that, we can really increase our emotional vulnerability. We can have a more positive emotional space, and so on. So that last piece, the last one, is really, I think, just really critically important as well of all these, that emotional regulation piece. There's different toolkits within that toolkit in DBT. One example of that might be an exercise called opposite action. And this is really where addicts are for a lot, but it's identify how you're feeling and do the opposite, which sounds kind of what, but I think sometimes and especially if we're in early recovery, our initial emotional reactions are not probably the best. And we have instinct that is sometimes guiding us in totally the wrong direction. And so this is not something probably that's done later on. We have more of a handle on our emotions, but that do the opposite can be very useful, actually. So if you're sad and feel like withdrawing from your family and friends, force yourself to do the opposite. Reach out, make a call, make contact, make plans, stay social. So that's the kind of thing. We're fighting our own inner urges and then helping us kind of get reconnected and reconnected in a healthy way. So that's really just a really quick overview of DBT. It's a marvelous set of skills and really useful. There are some really good books out there, DBT workbooks. So I'm not at home. I don't have my bookshelf in front of me, but they're around. So there's a lot of stuff out there. So I'll leave it at that. Thank you, Scott.
Thanks, David. Type your questions into the Q&A feature. We'll get to as many as we can. We got a couple in there already, and we've got one left from last week. But I got a couple of quick questions before we get started about DBT. And these are less questions and more comments. You know, number 2 and number 4, distress tolerance and emotional regulation. This is what we do with our addiction. We just do it in a very unhealthy way.
Exactly. Yes.
So when David says, distract yourself, he's not talking about look at porn for the next 4 hours.
I'm certainly not.
When he says healthy self-soothing, he's not talking about alcohol. When he's talking about emotional regulation, he's not talking about, numbing ourselves, which is what we do in addiction. And it's we have to learn healthier coping mechanisms. And one of the great things about DBT is it teaches healthier coping mechanisms. That's kind of almost the whole purpose of DBT, isn't it? To
Absolutely.
recognize when you're struggling, and here's how you can cope in healthy ways. Whereas cognitive behavioral therapy is more about recognizing your thoughts and just kind of trying to change your thoughts. But it's DBT is much more action focused, I think. Am I correct? Or
totally. And I call DBT kind of more present tense activities. And a whole complete therapeutic approach toward dealing with addiction would obviously include, diving deeper, right? Looking at the past, looking at older behaviors. But this is surface level skills to help us get through life, basically, in combination, ideally, with trauma work or whatever else we do. But yeah, these are important skills.
Yeah, and in early recovery, whether we're an addict or a loved one of an addict, we need in the moment skills to make it through the day without relapsing, without, wanting to knock somebody's head off or because we don't know how to do that. And particularly addicts, when we take away our coping mechanism of alcohol or drugs or sex or porn or whatever, we're left with sort of a flood of emotions that we would rather not feel. And, if you're like me, you started avoiding those emotions, in middle school. And that's where your emotional growth stopped. And, I was a 11, 12-year-old kid when I got sober at 38, emotionally. And I needed these skills. So thank you. Shall we jump into Q&A?
Yeah, for sure.
Okay, this one is left from last week. This is from a betrayed partner whose husband has been telling her that he loves her and wants to get back together. But on phone calls, he immediately gets defensive and always says, I have to go, if she says anything even remotely challenging or, unpleasant. Like, I've heard this all before, I need to see some action, things like that, which are reasonable things for a betrayed partner to say. Is there any advice on, or any thoughts about, the husband says one thing, but still can't tolerate any kind of distress. What should he be doing? What should the betrayed partner be doing? Kind of right on topic, actually.
Yeah, no, it's really quite perfect. Yeah, so obviously that's more than less than ideal. It's really that has to change, right, for recovery to move forward. And so when I hear someone who's not willing to discuss or can't tolerate that distress that such a conversation might have, and we kind of withdraw or hang up or don't engage in it. That's an old addictive way, right? Because one of the hallmarks of addiction is avoid. We avoid unpleasantness, we avoid feeling uncomfortable. So I think being able to face that stuff head on is really not only ideal, it's essential. And so I think some of these skills, actually, these DBT skills are right up. They're a good match for this problem. But I think I would perhaps your husband can work with his therapist. Hopefully, he has one to talk about some of these issues. And if you have any kind of couples work, or if you can communicate somehow. And suggest that, because I think that's a really important piece. You can't heal if you can't talk, and if you can't talk honestly and frankly, and with vulnerability and frankly a little bit of trust, that there's a conversation. You need that to invest in the relationship, and so if he's not able to do that, that's a problem. And so I would really suggest skills like these, like DBT, because it can help him build up his ability to have those essential conversations for recovery. So I think that is a problem that I think needs to be addressed, and hopefully his therapist can help him with that.
Yeah. Now, I have heard advice given, not in our treatment center, not in our work groups, but from sponsors in 12-step programs, from fellow recovering addicts. If you're on the phone and the conversation is too triggering, and you think you're going to act out, you need to get off the phone. Is that ever a valid piece of advice? And if so, when and how do we know when that is no longer a valid piece of advice?
Right. So I think it is true that in relationships that have been stressed, like a marriage, experiencing sex addiction, or in other tough emotional situations, or in conversations, right, that I think some people, both parties, can become triggered. And I do recommend to clients, as a way of de-escalating those situations, to step back for a few minutes. Right? And it's basically to step back, get out of the reactivity, and get more into do some breathing, get centered, get clear, maybe make a call yourself, but then come back and re-engage. I think that's the key here.
I need a timeout. Can I take 10 minutes and call you right back so
exactly.
we can continue this conversation?
Exactly. It's not fair.
Because I care about you enough to continue this conversation, but
exactly. It's not okay to just say, okay, I can't deal with this, bye. Because that's just running basically, or avoiding. But it is, in my opinion, it's okay to take 10 minutes to recenter yourself, regroup, get support. You do whatever you need to do, but then it's critical to come back and pick it up again. And otherwise, it's just terribly unfair to the partner to just kind of walk away. And so I think so in those situations, yeah. But I think the second half of that, yes, take a break, take a time out, but come back. That's the key.
Center yourself, do some deep breathing, call your sponsor, and call your therapist, whatever, get grounded, and then do the 5, 4, 3, 2, 1 sensory, or a gratitude list, or any of the DBT techniques or other sobriety techniques, and then come back and continue the conversation. And that's what recovery is all about, is we need to learn how to address emotional discomfort in a healthy way, which is working through it, not avoiding it. Addiction is all about avoiding it.
Exactly.
And it doesn't work.
Exactly. Yeah.
Okay. I love this next question. Is it important to have a different CSAT from my partner, or is it okay to see the same one? I have strong feelings on this. I suspect you might as well.
I do. Yeah. So as a therapist, I think in my head that I can keep two cases in two people's sets of needs separate. But I think from a practical point of view, it's really best for each party to have their own individual CSAT. And the reason for that is because each party really needs an advocate that's kind of 100% invested. So I think it's important for both parties to have their own advocate. Do those advocates, therapists talk? Yeah, they probably need to, especially if there's a disclosure being upcoming and planned. But I think it's just really hard. And I've seen this done where the same therapist tried to do both. And ultimately, one party typically starts to feel that, well, my therapist really has the best interest of the other person in mind more than me. It allows the opportunity for triangulation, and it's just not a healthy situation. Can it be done? Yeah, but I think ideally both parties should have their own CSAT. Short.
Yeah, I'm 100% in agreement. There may be things that I know I need to disclose to my partner, but I'm not ready to do it. So I need to have my own CSAT so we can have that conversation, and that CSAT can work with me getting ready to disclose. If that CSAT is also my partner's CSAT, suddenly my poor CSAT's caught in the middle. My partner wants to know everything, and my CSAT knows something that I'm not ready to tell.
Right.
And it's brutal for the CSAT. And I've seen situations where the CSAT also tries to be the couples counselor. And even if there's an agreement, like no secrets, if you tell me something in here, I can tell it to your partner and we can, but it's really hard. You need your own person.
Yeah, I agree totally.
So, I am a male sex and porn addict in recovery for just about 1 year. 2 weeks ago, I had my first and hopefully only relapse with pornography. I willfully and consciously downloaded an app to view pornography where real people post themselves sexually. My partner found out before I could tell her via tech monitoring software. Any advice about where to go or how to proceed from here would be helpful. I do have a full 7-day-a-week schedule, including meetings, webinars, psychoed, and therapy. First of all, I just want to say, you are taking responsibility for this. You did it. You're not blaming anyone or anything. You made a choice, and that's a good sign. Now I'll turn this over to David.
I agree with what Scott just said. This is a good thing. I guess I look at this as kind of an escalating set of choices, right? Depending on success. So I think you're doing a lot of work here with meetings, webinars, and so on. I think, first of all, I hope you're in therapy. Psycho and therapy, because these acts, aren't just random. Something happened, and I think it's going to be really critical for you to know what the pattern was, what was the trigger, what happened, so you don't have to make that mistake again. And so I think just really having somebody to process this event with is a really important thing. Especially after a year, something's going on. And sometimes it's the time. I have clients that, relapse at 90 days or a year. There's something about those big round benchmarks that get scary. But I really think it's important to take a look at that. Now, that said, what I also think is probably important to increase the activity you're doing. And it may be something like the porn work group that Seek Integrity offers, 6 week, 90 minutes a week, that kind of thing. Beyond that, you might, if that doesn't work, or if that's not enough, you might sort of think about an ILP or, I don't know, something else. And then that's what I do with my clients. If they can't succeed at one level, we increase the intensity a little bit in some way and keep going up until we can solve the problem. But I think definitely, although you're doing a lot, it wasn't enough in this situation. I think it's important to understand why. And I think it's important to kick it up in terms of your recovery activities somehow, or shake them up, do something different. Because like the online course, something like that, just to add some intensity to your program of recovery.
Yeah, and David mentioned the porn addiction work groups. We also have sex addiction work groups if you have a wider spectrum of behavior than just porn. Last night in my level 1 porn addiction group, we talked about slips and relapses. And I just messaged you, send me an email, scott@seekingintegrity.com. I will actually send you the homework from last night's porn addiction work group about slips and relapse, which might help you dissect what happened and kind of figure out where it actually started, because it starts way before we pick up our phone and start downloading an app.
Exactly.
So yeah, and sign up for one of the work groups. It's a good way to step it up a little bit and get some information. So yes. Are the statistics of getting and staying sober and in recovery more or less with sex addiction versus substance addictions? There's more to that, but let's take that part.
Yeah, so recovery statistics are always a little hard to talk about because it's often apples, oranges, and grapefruits and pears because people have different definitions of what is recovery, what is sobriety, and in terms of length of time, does that include never having a relapse? Is that from day one? Is that having a slip? Is it what do you count as that? Does emotional slip equal an acting out? So it gets very complicated. Bottom line, addiction recovery, and Scott, you might, I'll see what you think too, but I think my experience with this is that basically the rates of recovery are fairly similar across all addictive disorders, and that there are certain ones that are a little more difficult, I think. And unfortunately, sex, porn, amphetamines fall into that category, simply because of the sheer strength of the dopamine that's released. They're highly powerful, triggering addictive behaviors that kind of set down this anchor in your brain that's really hard to let go of because it's so bright and hot, and so there's a lot more triggers and cues. However, that's why we focus so much on looking at these underlying behaviors and the triggers and cues. They can be managed that way. The other hopeful thing I'll just say is across all addictive disorders and behaviors, if you can stay sober a year, your chances of remaining sober rapidly go up. And so the first year is the one that we really focus on for, problems and trouble. And then obviously we can't just take a holiday after a year. We still have to keep working our program of recovery, but the chances of relapsing get less and less. It can happen. And Scott and I both know people who've been around for, decades who've relapsed. And that's really, really unfortunate. But in every case, it didn't just strike them in the dark, right? They relapsed, I think, because at some point they let some aspect of their recovery program get a little sloppy or loose or abandoned. And so it doesn't happen by accident. But I think if you can stay sober a year, the statistics show that it's going to get far better. But overall, I think it's so hard to compare numbers, but I think they're basically similar across different addictive disorders.
Yeah, I agree completely with all of that. The rest of this question is, are sex and porn addiction harder to detect than substance addictions?
I guess yes and no. Substances often are you can tell pretty obviously if somebody's, taking a substance or impaired on a substance, and it might be a little easier to hide, covert behavior with sex or porn addiction. However, I think there are such strong addictions. I think the kind of wreckage of those behaviors does show in patterns, and whether it's irritability or bad communication or blaming or gaslighting or evidence of betrayals or other kinds of things, it does come out typically. So yeah, maybe a little bit more. It's maybe easier to pass for a while, but I think that it's not sustainable. It does come out.
Yeah, again, I agree. You can hide porn addiction in particular because it's a very private affair. You can hide that for quite a while, but eventually your spouse is going to say, why do you spend 2 hours in the bathroom before bed every night? And, things come out eventually, and the world crumbles eventually.
Right. And sexual interest sadly, fades, and intimacy goes away, and all those other things that people feel.
Yeah, and the longer we're able to hide our addiction, the worse the damage we do. It just compounds and starts to grow exponentially. So the sooner you get caught, the better.
Yeah, I agree.
You know, mindfulness is easier said than done for me. Me too, by the way.
It's true.
As a partner of a sex addict who's been verbally, emotionally, and psychologically, I'm going to say abusive for a very long time. Are there additional components to help me with mindfulness? And abuse is a strong word, I realize that, but that there was a word missing, I added abusive.
Yeah. Mindfulness is hard. And it's an easy thing to describe, but our minds are racing and pulling us in all kinds of directions all the time. And so to really focus it is really hard. And I didn't say this before, I'll say it now. I think sometimes the goal for mindfulness is not to go through your life in that state all the time. I think the goal for mindfulness is just try to stay focused for 10 seconds or 30 seconds or a minute. I mean, it comes down to that sometimes. We're so distracted in our lives. It's really hard. It's a skill though that does get better, and you can kind of build that skill. But I would in terms of just strengthening it to compare with it, I would try to strengthen the mindfulness piece, and I would just really allow yourself to just be quiet sometimes. So mindfulness, as I said, is that active focus on what's going on with me. And there's a kind of a corollary of that is just kind of letting your mind go blank and just letting it empty out. And I think those kind of skills also can be very helpful in noticing stuff when it comes up. But I think just it takes practice. The other thing I've seen sometimes work pretty well is to really start to focus on sense awareness, meaning seeing, hearing, tasting, smelling. Just we know that if we can enrich our sensual experience, that adds to our ability to like be in touch with our body, with our feelings, with our thoughts. And by the way, it also helps intimacy and sensuality. I'm a sex therapist, and that's one of the techniques we use to improve sexual performance, is that increased sensual awareness. It does really, really help. So I think the best thing to do with sort of getting better at mindfulness is just practice, frankly, and again, no judgment. So if you can only do it for 15 seconds, that's okay. You know, maybe next time try for 20, but it's a slow build up for sure.
This next one, we've been getting variations of this question a lot. What is your professional understanding and experience of magic mushrooms helping addicts heal? Is it appropriate for a relapsed sex addict to pursue?
Right. So we are seeing a lot of interest right now in hallucinogens, psychedelics being investigated for potential therapeutic benefit. MDMA, along with psilocybin, are the two I think that are most prominent. Ketamine, too. And some of these drugs have been approved. There's people that are now microdosing and doing all this stuff. I'm in California right now. There's a certification here for therapists to do this. I think we're a little over our skis here in terms of what's happening. And
over our skis means we're about to crash.
Yeah. Okay. Right. We're heading
it's a bad position.
Yeah. That may be good for other folks, and I'm not even saying that, but for an addict, I think that's just a bad choice. It's first of all, we don't know very much about these yet, but we also know that addicts do anything to avoid and soothe and diminish feelings, and there's a lot of things that we use our addictions to help us cope with. And I think to rely on anything external, even if it's a healthy drug, also, by the way, if it's a prescribed drug from your doctor, we need to use it with great judgment and care. So I think it would be a terrible error for any addict, relapsed or not, to do that. I think it's just I just think we don't know enough. And I think even when we know a whole lot, it's still going to be a bad idea, because they're still relying on external solutions to solve something that is far better managed with skills like DBT, frankly. I'd be very, very cautious. In fact, I wouldn't do it. If you were a friend or family or a client, I would say that's a hard no in my book.
Yeah. And I'll just say I have seen several people try these alternative recreational drug therapies, because that's what we're talking about here, recreational drugs. And I have seen it go very, very badly. Now, I've also had people, I have a couple of therapists. One of them is an advocate for it. The other one has tried it. And when he started talking about it, he sounded just like I sounded when I was 20 years old and dropped acid for the first time. Oh my God, it was so wonderful. And you know, he sounded like a drug addict. And I just said, wow, you sound like I sounded when I was a drug addict. I think this is a bad idea. And he took great offense to that, because he had had a spiritual experience. I was like, no, you got high. And that's my feeling. Just NFW, no freaking way. My opinion is much stronger than David's, or David's much nicer than I am. I just think it's a terrible idea. You're treating addiction with an addictive substance. Don't.
Yeah.
Bad idea.
Yeah.
Sorry. Okay, now I'm calm. This is a betrayed partner asking. My addict partner wants to get credit for not leaving the conversation, but he's also not really engaging or participating. So I don't give him credit, because from my perspective, it's still the same. He still tied of the misty cloud partner. I'm not sure
tired, maybe tired.
Yeah. But yeah, you've got a partner who's not present in addiction, and now you've got a partner who's not present in recovery. Thoughts, David?
Right. Yeah, I mean, it's not unusual for a partner, especially in early recovery, to want to get credit, want to move this thing along faster, for making an effort. But I really trust your gut on this. And in terms of, if you don't feel there's a connection there, in terms of that authentic emotional connection, communication back and forth, compassion, empathy, and so on, that's something to be aware of. And I think that's a measure, and that's a hard one, because it can be subjective in terms of the judgment of the quality or the nature of that. But I think I do tend to trust the betrayed partners on this, because they're very highly attuned to this, and they can feel when somebody's really engaged or not. And I think it's important to not just accept that. I think to give feedback that this doesn't really feel like you're quite there yet, and to really push for that. And it may be something. And by the way, as the betrayed partner, I think you can give that feedback. You have the right to give that feedback. That's how you're feeling. You're sharing your feelings. You may not be the one to be able to help him do that. I think he probably has to rely on his CSAT or his support group to help him figure out how to get more intimacy, get more involvement, get more trust, more vulnerability, whatever's missing from the conversation. But I think you certainly have a right to point it out. You are the person that needs to point it out, but you may not be the solution. He needs to find that. He may not be able to hear that or accept it from you, but he needs to get it from somewhere.
Yeah, I agree wholeheartedly. And I encourage you not to give him a free pass here, but to look at the fact that he's at least sitting there physically as probably progress from his addiction. He's at least in the room physically. This is probably progress. And, I'll speak for addicts. It takes us a long time to come back into the world. The whole point of addiction is for us to escape the world. The world is not going well for us. Anytime we have a feeling in the world, we leave. That's what we do. That's the whole purpose of addiction, is to numb out and not be present. And I did that for 25 years. It took me a while to come back into the room and be able to stay in the room, because I didn't know what I was feeling. I didn't know how to tolerate my feelings. I needed all of these skills that David was discussing at the beginning of our session today. I didn't know how to sit there and, I didn't have any distress tolerance. It was all I could do to sit in the room and have somebody talk to me, even if they were being pleasant. It was just really, really hard. So he will come back. If he's doing the work, he will come back, but it usually starts with his therapist first. I'm being sexist and saying the addict's a him, but his therapist first, and then his 12-step sponsor, and then his buddies in recovery. and then he starts talking to the dog, and eventually he starts talking to and being present to you. We've talked about this before. You're the last one invited to the party because you're also the one who can hurt him the most. You're the one who matters the most. So for him to be vulnerable and present with you is harder than it is for him to be vulnerable and present with me. Because I don't matter, you do. My partner has been told about disclosure and is resisting. He's probably lying to his counselor that he's done it. So it probably thinks that my initial discovery of his cheating is the same thing as disclosure. It is not. David, thoughts?
No, they're definitely not. Disclosure is that horrible moment when you are found out as an addict that something has been going on.
That's discovery. Discovery.
I'm sorry, discovery. That's what I meant.
Yeah.
Sorry. Discovery is that horrible moment. Disclosure is very different, right? Disclosure is that formal procedure that usually occurs several months into recovery, even longer than that sometimes, 3, 4, 6 months, sometime in that window. But it's a formal process that requires a lot of preparation. There's written documents. Both the addict and the betrayed partner have therapists that guide them. There's exchange between the two therapists in terms of how the documents work and so on. So it's a very formal procedure. Why? Why is it important? Because just experience has shown if we want to really repair a relationship and heal, we need to kind of clear the wreckage and get everything on the table. Otherwise, you're building this foundation for healing on a very shaky ground, because there's still secrets, there's still something that's not revealed. And addicts do resist this because it's like, something happened 20 years ago. What does it matter? Well, it matters a lot because it explains the pattern, and it's part of the whole story, and it's part of the addictive behavior, and it needs to be out there. And frankly, just out of fairness, the partner has a right to know the whole story before they decide how they're going to manage this relationship, or if they're going to even go forward with it. So this is a really important piece. So I think, I don't know who, perhaps your husband's therapist can help him understand the need for this. If he's being honest with the therapist, and that does happen, that people aren't always honest to that extent. But discovery is a really important piece. I'm sorry, I'm really tired. Disclosure is an important piece, and I think that's just so important for everybody to understand. If the marriage is going forward, now if you've decided to split, if you're going to get divorced, then the need or the importance of disclosure really goes away. But if you really want to try to fix this marriage, then that's going to be a critical step to undertake. And it's threatening, it's scary as hell, but it's a really critical piece.
Yeah. I just popped in, Matt Wheeler did a full hour on disclosure, I don't know, 6-8 months ago. I just popped the recording of that into the chat feature. Anybody who wants to know about disclosure, it's an hour. It is well worth your time. It's brilliant stuff. I'm going to take this question out of the chat feature. I'm trying to take them in order here. So do addicts set themselves up to be triggered? I always felt like my sex addict partner would look for a fight to have a reason to act out. If so, what is the proper response for the sex addict's partner? Can I confirm before you answer, David, that yes, sex addicts do that. I teach work groups, and part of the denial that we have to address sometimes is you pick a fight so that you can get angry and justify acting out. And they all nod and go, yes, I've done that. I want to validate that, yes, sex and porn addicts do that. Okay, David, what is the proper response for the partner?
Yeah, no, I totally agree with that. That's people fish sometimes or look for an opportunity to create an outcome that they want. So I think the response of the partner is a couple things. One is to be a straight shooter in terms of what you see. You have a right, first of all, you have a right to your feelings and a right to what you're seeing and a right to express it. And so that's why I always think daily check-ins are really important for a couple to call and sit down and or by phone, however you're seeing each other, and communicate and share what's going on. So sharing those feelings is going to be important for one thing. Second is to really see that there's some kind of response, that you have a right to response, and to handle it differently, and to not, whatever metaphor I want to use, not play the game, not dance the dance. I think just sometimes couples, when they've been doing this for so long, for so many years, it's like an automatic thing where they kind of, these arguments start to escalate. And I would encourage you to not play the game. And if you see that happening, if you feel that's happening, call it out, and then maybe disengage, or say you can. I think another very helpful way to do that would be to really sit down and talk, to invite the person to really talk about the actual issue, instead of creating a distraction or a sidebar that can pull everybody off into the weeds. So yeah, I think to really express your feelings, you have every right to feel whatever you're feeling, but also really call out the behavior and suggest and invite the person to have a more frank and honest discussion. And I think, and then if they can't, I would step away and try to come back and regroup, and maybe try it again, or maybe call in the help of a third person, a therapist, couples therapist, someone who can help you. That's probably a great, actually, format. I've done this many times, where you bring a couple into the office and you kind of just moderate a conversation, and that sometimes can help the dialogue move in a way that can't when it's just the two people without a third person.
Yeah, and if you can find a couples therapist who's trained in emotionally focused therapy, they'll have an EFT after their name. It's kind of the gold standard for stopping the dance. This dance where you know the steps, your partner knows the steps, and you just, one person takes one step in the dance, and suddenly you play out the whole dance.
Right.
And you end up mad at each other and acting out, and that's just the dance that you do. Emotionally focused therapy slows things down, parses each step of it, gets the feelings out, gets the needs that are not being met out, and you learn how to stop the dance. But any good couples therapy can kind of couples therapists can walk you through that. But EFT is a specific format for that works really well. So
yeah,
I don't know if you
have also like, by the way, I totally agree with that. I also like imago therapy for that too, which builds on communication, very similar stuff. Yeah.
Yeah, that's imago, IMAGO. You can look, don't dance with the narcissist. Yeah, good advice. Thank you. That was in the chat feature. So,
good point. Yes, I agree.
Yeah, I understand why addicts don't want to disclose because they fear that the spouse will leave if he or she knows everything. But is it reasonable to say the spouse might very well leave, or is the expectation for the spouse to say, I'm going to refer you back to the link to the disclosure video webinar with Matt Wheeler I put in there, but disclosure is generally done when both parties want to save the relationship. As David said earlier, if you're planning divorce, don't do disclosure. It's just, it's a rough process. But if you're trying to figure out whether you want to stay or not, or you're waffling, you should probably do disclosure, because disclosure is where the healing starts. It's where the betrayed partner gets all the info and gets back to ground zero, so that she or he can actually make informed decisions moving forward. And as an addict, yes, there is a possibility that this might be too much, but there's also a possibility that my spouse will say, okay, now I can stop all the incessant questioning, because now I have the truth, and we can work on rebuilding trust and developing intimacy. 99% of the couples who do disclosure are glad they did it, whether they stay together or not. And that's from advice from Steph Carnes, who's like the queen of disclosure. So anything you want to add?
Yeah, and I would just, the only thing I would add to that is that very often betrayed partners, the real wound, the real harm is not necessarily the deeds themselves, but the deception and dishonesty and gaslighting that happens afterwards. And so I think, first of all, disclosure puts an end to that. It puts everything on the table. But it also it validates the partner's feelings and just gets it all out there. And so I think very often, yeah, nobody's happy with the actions of a sex partner if they're involved with one. But I think very often what people really express a lot of dismay about is what is the dishonesty about it as opposed to the act itself. So I think the disclosure does two things. It gets everything on the table so that everybody's fully informed, but it also puts an end to the gaslighting and the lying and manipulating and all of that. I think it's really important.
Yeah, disclosure is good for both parties. If you want to stay in your relationship, do disclosure, stop fighting it, do it, and do it well.
Do it well, indeed.
Do it with a therapist guiding you through the process. As a matter of fact, the addict should have a therapist. The partner should have a therapist. It should not be the same therapist, going back to our earlier question. Right. And sometimes there's a couples therapist as well. So often there are 3 therapists in the room. Sometimes there are 2, but so each party has their own advocate and can process. And disclosure is not an event, it's a process. Usually the betrayed partner submits some questions. I, as the addict, will answer those questions in a written document, which I will read in a joint therapy session with both of our therapists. And then a couple of weeks later, we come back. My betrayed partner reads an impact letter that she or he has worked on. And then we come back a couple of weeks later and I do what we call a restitution letter. I feel your pain. I understand what I did. Here's what I'm doing to change my behavior. So this process goes on for a month, and often there is a polygraph involved. More and more often, people are doing polygraphs just to prove that, yeah, I really did tell you everything. And the only reason to fear a polygraph is if you're holding back. So yeah, I'm a big advocate for disclosure.
Yep.
Love this next question. How do therapists, I'm just going to stop after about 8 words here. How do therapists know if the addict is lying when he's in therapy?
Well, I wish I could guarantee that I always know. I think most therapists have a pretty good gut instinct after a while and can kind of root out the BS with all the words and stuff. There are times, though, when we just don't and we can't verify. And that's why it's important to be able to talk to collateral sources of information, like a wife or family or employer, just to get the real facts. Because I'm a recovering addict. I always wanted to kind of portray everything, even if I had to lay out the messy life of my addiction when I was in it. I always tried to put it in the best possible light. So I might, minimize or cover over something or forget some uncomfortable detail. And so that does happen. That's what the mind of an addict does. And so can we verify all that? No, but we can sure try, and we can get information. One of the things we do, and this is what a great thing, I think, in terms of a program like Seeking Integrity or a residential treatment program where you have people for some time and you have peers in the group as well, we can really start to look at what someone's telling us and sort of kind of pick it apart. Well, you said this, but what you just said doesn't match that, or the time frame doesn't work. And we can start to kind of put stuff together. And I think that's kind of what we do, because very often in the beginning, an addict will have a very smooth, seamless story that there's just kind of nothing to get your fingers into, right? Nothing to grab onto and work with. There's no discrepancy. And so we look for that. And so, yeah, I mean, have I been fooled? I'm sure I have, and I think any honest therapist would say the same thing. But I think over time we get better. And also, by the way, I think the advantage of a place like Seeking Integrity is there's a team of people, and it's harder to fool a group of people. I might have a blind spot, but my colleague next door in the next office doesn't have the same blind spot. And so we, as a team, we work together well. But I think, does it happen? Of course. But I just tell clients, what a waste of money, your money and my time. It's like, why come to therapy and why? And I know it happens all the time, but I think it's just such a a defeatist strategy. It doesn't work. But yeah, so I think we have ways of interviewing and talking to try to minimize the amount of deception, but I'm sure it does happen. But the foolproof method for that is talking to people in the family or talking to the wife or husband, seeing what's going on.
Yeah, I'm going to read the rest of this question because it kind of falls right into that. I have not been allowed to talk with his therapist for years. Partners are truth tellers, and he's not sober, but claims he is to his support. He's also lying to our adult children, etc., etc. It's painful how this affects my sons too. It feels hopeless. So yeah, I mean, one of the things like we'll do at Seeking Integrity is we'll push the guys. We need to talk to your partner. We need to talk to your therapist. We need to talk to. We push them to sign release forms so we can actually communicate and get all of the info.
Right.
And it sounds like this therapist may or may not be getting all the info. I'm going to pull
and just
this,
like I'm not allowed to talk. I mean, that's what we just said. It's so important to do just that.
Yeah, and therapists hate being in that position where they really want all the info and can't get it.
Right.
So I'm going to pull this out of the chat feature. This will be our last one, and it's just a real quick one. I told my wife everything on January 14th. I'm assuming that's a disclosure. We've been doing better and better every day. I'm no longer acting out. We both have our own therapist. We're both doing great. It's not easy, but it has been great rediscovering our love for each other. Awesome.
Wow.
Would you recommend a second disclosure at this point? There's absolutely nothing to add to the first one, but I'm going to ask my therapist, but what is your opinion? My personal opinion is that there's nothing to add. Why? But David.
Right. Because the first one was so much fun.
Yeah.
I think the protocol is a single disclosure, unless there's some major thing that comes out that needs to kind of be almost like an addendum. But I don't see the point of, first of all, it's very expensive, emotionally draining, time consuming, intensive activity. I don't, unless there's something really big that didn't come out, I don't think I think it's the kind of thing that can be handled in a therapy session with, a couples session, something like that. That's how I would prefer to do something like that.
Usually if there's something to add, it just happens in a couple session. You talk to the couples therapist and your therapist, they'll work together and say, listen, there's something I forgot to put in my disclosure. It was an honest mistake, but I feel like I need to come clean. And then you do it. But having a whole, disclosures are a process. Yeah. We've got several questions left, so I'm going to keep them for next week, and I promise we will go to those first. So please join us next Wednesday, same time, same place. We'll pick up the questions we did not answer today, and then take new ones. So cool. Thank you, everybody, for being here. David, anything you want to say to take us out?
I'm going to go over the 4 strategies of DBT that I mentioned at the beginning: mindfulness, building up to stress tolerance, interpersonal effectiveness, and emotional regulation. Those 4 things are incredibly important.
Awesome. Thank you, everybody. Thank you, David, as always.
Thanks,
Thank you
Scott.
for great questions today. And we've got several more lined up for the beginning of next week, so we'll get to those. Have a good night, everybody.
All right. Thanks. Bye-bye, Scott.